The CDC estimates right now that 1 out of every 4 patients in a U.S. hospital is likely to require a hospital-acquired infection. That means that hospitals do their best to clean the environment, but there's still some contamination remaining, and those dangerous pathogens put us all at risk. We hear about really frightening sounding bugs like CRE and MRSA and C. diff, and all these acronyms that mean very dangerous things to our health. But Xenex is able to disinfect all of these bugs within anywhere from 2 to 5 minutes per room. So after normal cleaning, the user would prepare the room by exposing high-touch surfaces, like for instance the remote control or the call button that we touch a lot. And then they would push the device into the room. They have to push just a few buttons to enter in the room number, and then start it and leave the room. After they've left the room, it raises up a bulb and starts to pulse that bulb, and that's producing UVC. UVC is actually filtered out by the ozone around the Earth, meaning that bacteria and viruses do not have mechanisms to defend against it. So it's able to disintegrate their DNA, it fuses their DNA and causes massive errors throughout the cell, meaning the cell can't replicate, it dies, and sometimes it even bursts open, which it cannot recover from. So while it's pulsing, it's doing that to the bacteria and viruses in the room, making sure that they are all incapable of causing any harm to anyone else. It raises up to about 5 feet so that it reaches the high-touch areas, which are as far as we can reach, down to as low as we can reach. And then after it's done, it retracts the bulb and sends the user a message externally outside the room that the device is done and it's safe to go back in the room.